Today, I would like to explain the basic fertility tests you need to check if you are out there trying to conceive mother. The reason I'm doing this is because I've noticed some women don't know the right fertility test to do, while some know the type of test to do, but they don't know the particular time to do it because it's all about timing. So many people do a fertility test and they just go and check it any time of the month. And sometimes it gives you wrong results. The female body is very dynamic during menstrual cycle. There are different times the female body releases some of these things we are checking. So if you check it during the wrong time, it gives you a wrong result, or either prevent you from having treatment or makes you treat something that you don't even have. So I'm going to explain all the fertility tests that you need to do today. So before that, I would like you to understand the basic knowledge. You will understand the test to check, why we check it, and which one you need to check. So you don't just go spending money doing all the tests you don't even need. Remember that I say that when it comes to a woman, delay in getting pregnant has different levels. There is a level that happens from the brain, there is a level that happens from the ovaries, there is a level that happens from the tubes, and there's a level that happens from her womb. And most of these fertility tests are targeting the function of checking most of these levels. So I will explain each of these tests in detail. So the first set of tests you need to know are tests that checks the levels from the brain. And what do we check? We check two things basically. We check what is called LH and FSH. So most of you have heard about LH and FSH and when you go for hormone profile. That LH and FSH are the signal your brain sends to your ovaries and other parts to perform this function. LH, which we call luteinizing hormone, which what it does is that it stimulates the production of the eggs. LH on its own has the luteinizing hormone, stimulate the production of the egg from your ovaries. And that's what happens when you have this ovulation kits. You know, some of this ovulation, you check around your mid-cycle, whether it tells you whether you ovulate or not. What they're actually checking is the level of your LH, because just before you ovulate, the levels of your LH will rise. So that's what most of your ovulation kits are checking. Alright, that's why we check LH. Now the other one, which is called FSH, it also checks the level from the brain. What FSH does, it helps your ovarian follicles to mature. Some of you will go for the test, you will check FSH. You will see your FSH is very high. What happens is that if your ovarian reserve is actually getting low, maybe it tries to overwork itself, probably to mature what is left. So it produces so much FSH. So when you check your hormone and you see your FSH is higher than normal, it's actually a pointer to either one of two things. Either your ovaries have stopped working, you've gone into menopause. Now you understand why we check LH and FSH. Very important. Now the third thing, we check for prolactin. You see this one? This prolactin is a common problem in many women. Yes, majority of women have high prolactin. Prolactin and that FSH that helps your ovarian follicles to mature, they don't like each other. So prolactin, when it's high, it reduces your level of FSH automatically. That is why your ovarian follicle doesn't mature. So if you have high prolactin, that is why it leads to a delay in getting pregnant. The other thing we check is your estrogen. When we look at that hormone profile, you know it has many hormones in it. This particular estrogen does a very dramatic thing. Now, when you are not fertile, remember that the sperm needs to come into the woman's reproductive tract to meet the egg and form a baby. Now, before the sperm can pass through the woman's reproductive tract, there is a door there that is sealed with a very thick mucus. So what estrogen does is estrogen will go and dissolve it and then it will fall out. So that cervical mucus you see as a sign of ovulation is estrogen that is causing that. So it has removed it so that the sperm can enter. This is a very important function that estrogen carries out. Now the other very important one is progesterone. You see, this progesterone, you will see it in your hormone profile a lot. It's so important in not only helping you to get pregnant, but in keeping that pregnancy. That's why progesterone is so vital. So what it does, progesterone goes to your womb and makes it soft like poly, preparing your womb to be able to receive the baby, so that your baby can grow there. And then progesterone is the hormone that is responsible for nourishing your baby from when you conceive up until when you give birth. But some women have low levels of progesterone, even way before they get pregnant. And that is why we check it, okay? So these are different texts in your hormone profile. And now I hope you understand why we do it. So another common text, very common text we do, and I'm very particular about this one. It has to do with checking the functions of the tubes. The tubes in a woman is where the sperm of the man meets the egg of the woman to form a baby. So after it has formed the baby in the tube, that formed baby now moves from the tube to the womb. There the baby will remain in the womb and grow till she gives birth. So the sperm of the man and the egg of the woman does not meet in the womb. No, it mixes in the tube. And that is why the tube is so important. That is why it's important you check if the tube is performing okay. This test, many women don't like it. Some of you have gone through it, know what I'm saying, because it can be painful, it can be uncomfortable. This HCG test, many women don't like to do it. They don't like to go through it. So what does this HCG do? It checks if a woman has tubal blockage. Text is a text where the woman lies down. They will inject something like a dye, and then they will take an X-ray. So the X-ray will be checking if that dye that they injected is passing freely. If it's passing freely, it means there's no blockage. But if it's not passing freely, it means there's a blockage. Very important to do. So the last one of the difficult tests to do, not because of the technicalities, no, but because of the people involved. This one has to do with men. Men with their ego. And that is a seminal fluid analysis. It's a very simple test. Many people don't know how to do it, but for you to do a seminal fluid test, the man needs to go to the lab or the hospital. The test is going to be carried out. So don't produce it at home and then you start going there. Maybe you will just drive for 30 minutes or 15 minutes. No. To go and submit it, it's going to give you a wrong result. Okay? So basically, between the time the man produces the sperm to the time the lab runs the test on that sperm should be 5 minutes maximum. So it's something you will need to do right there in the lab or in the hospital. Okay? It checks a lot of things. It checks the sperm count. It checks the movement of the sperm cells. Because remember, when the man releases the sperm needs to travel to go and meet the egg. So it needs to be checked. It checks the shape and it checks some abnormal cells, some sluggish cells, some dead cells and all that. Even the motility. So these are the basic fertility tests to do as couples, as a woman, as a man. So the next time you want to run fertility tests, you now know the ones to do, right? If you learned something today, please drop in the comment section that you learned something today and tell me what you would want me to talk about. All right? See you on my next video. Bye.